This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, a senior attending here, and I'm joined by our research fellow.
And I'm Dr. Alara. Today we're looking at a fascinating new study from the British Journal of Hospital Medicine, 2026, titled Brachial Plexus Birth Injury, Current Concepts in its Assessment and Management.
This is a topic that sits at a very complex intersection of obstetrics, neurology, and neurosurgery. Even though we've seen this condition in the literature for a long time, it remains one of the more challenging obstetric complications we face. Alara, let's start with the nature of the injury itself. How does the paper describe the clinical course?
The authors emphasize that brachial plexus birth injury, or BPBI, follows a highly variable course. This is really the crux of the challenge for the neurosurgical team. On one end of the spectrum, you might have an infant with mild transient impairment that resolves relatively quickly. But on the other end, we see significant lifelong disability. Because the outcomes are so diverse, the paper stresses that these infants require careful, regular monitoring to guide our decision-making.
And that monitoring is critical because we aren't just looking at the nerves in isolation. We are looking at how the whole limb develops. Before we even talk about the operating room, the paper highlights conservative management. What are the primary goals there?
The conservative approach is really about preservation. The paper notes that a variety of techniques are implemented to ensure a full range of motion and, crucially, to prevent muscle imbalances. If we lose that range of motion early on, any future nerve recovery, whether spontaneous or surgical, is going to be hampered by joint contractures or skeletal issues.
Exactly. As neurosurgeons, we often focus on the electrical wiring, but the machinery of the arm has to be maintained for that wiring to matter. Now, let's dive into the surgical management. For the residents listening, what are the primary neurosurgical interventions mentioned?
Once the decision is made to move forward with surgery, the paper notes that management predominantly involves microsurgical nerve grafting and nerve transfers. The choice between these, or the combination of both, is a major part of the surgical planning. The goal is to reinnervate the target muscles before irreversible atrophy occurs.
And the paper also mentions that the surgical journey doesn't necessarily end with the neurosurgical reconstruction.
Right. It notes that microsurgery may be followed later by further orthopedic procedures, depending on the specific needs of the patient as they grow. It's a multi-stage, multidisciplinary process.
That's a key point for the trainees. A successful nerve transfer in infancy might still require tendon transfers or osteotomies years later to optimize function. Now, Alara, what I found particularly interesting in this 2026 update is the discussion on the current state of international practice. Despite how long we've been treating BPBI, what does the paper say about our current pathways?
It's actually a bit surprising. The paper points out that there continue to be broad variations between the management pathways favored by different treatment centers. There isn't one single globally accepted algorithm that everyone follows. This lack of standardization makes it very difficult to compare outcomes between different surgical techniques or timing strategies.
It's a common hurdle in neurosurgery, especially with rare or uncommon conditions like BPBI. It's hard to get a high-volume, uniform data set, but the authors mention a movement towards fixing this, don't they?
Yes, the paper highlights that international research groups are now actively working to establish a minimum standard of patient outcome data. The idea is that if every center starts collecting the same core metrics, we can facilitate more effective future research and finally determine which of these broad variations in management actually yields the best long-term results for these children.
It's about moving from anecdotal or center-specific expertise to truly evidence-based protocols. For our residents and students, this paper is a reminder that while the microsurgery is technically demanding, the real skill in managing brachial plexus birth injury lies in the assessment, the regular longitudinal monitoring that tells you when to intervene and which surgical tool to use.
Absolutely. It's a long-term commitment to the patient from that initial assessment through conservative management, microsurgery, and potentially later orthopedic corrections.
Well, that's a great summary of the current landscape. If you're heading into a brachial plexus case this week, I highly recommend giving this paper a full read.
Thanks for joining us on the Neurosurgery Hub podcast. We'll see you next time.
Safe operating, everyone.